The UK has been on lockdown for about a week, and other countries around the world have been shut down for longer, or are still in the process of being locked down. The coronavirus has impacted everyone's lives, and has made doing even the most basic things more complicated. So it's understandable that people are beginning to ask when this will all be over, and life can go back to normal. And that's what we're going to try and answer in this video. But just a warning, we're not going to give you an exact number. We're going to give you a bunch of different potential scenarios, so you have been warned. Before we get into the video, we wanted to acknowledge how hard it can be to self-isolate, especially if you're doing so looking after young people. So when we saw a few people asking for us to make countries with shoes colouring sheets for their kids, we thought why the hell not. So you can now download the sheet for free from our website. And if you email in your photos, we'll be sure to feature some of the best in our future videos. And if colouring isn't for you, you can still buy Countries with Shoes stickers, magnets and badges from our store. And you definitely don't need to colour those ones in. Links to both can be found down below. So, when can we start going outside? When can shops reopen? And when can we go back to the pub? Well, as I've already said, the timescale isn't exactly clear. But one thing we do know is that we're waiting until the majority of people are resistant to the disease. When the outbreak first started, no one was resistant to the coronavirus. That's because when this coronavirus, this new strain first emerged, no one had ever experienced it before. COVID-19 is a brand new strain of the coronavirus, unlike SARS, MERS or any other coronavirus we've experienced in the past. So no one was already immune. This meant that the virus ended up affecting many of the people who came into close contact with it. At the moment, scientists estimate that every person with COVID-19 infects on average 2.5 other people when they're not self-isolating. And while that might not sound like much, it multiplies out quickly across society. That's because if every person infects 2.5 people, then in a month, one case can multiply to 406 people. The logic behind self-isolation is that by separating yourself from other people as much as possible, you can't infect as many people, simply because you don't come into contact with as many people. If this even halves the number of people you infect to 1.25, then that's a huge impact. That's because if all the people we talked about a second ago were self-isolating, and only infected an average of 1.25 people, then over a month, it only multiplies to 15 people. So great, that's the logic behind locking us all away, but it doesn't tell us when we can come back out again. Because surely, as soon as we stop self-isolating, the average number of cases slips right back up again to 2.5, and then we're back to square one. Well, that would be the case if we didn't find another way to reduce the average infection rate. One way this could be achieved is if some of the population, ideally the majority, were resistant to the virus. This would also reduce the average number of people infected. For simplicity's sake, let's round up the average number of people infected by one person not self-isolating from 2.5 to 3, because half a person is a bit grim to animate. So if each person infects 3 people when not self-isolating, but 2 of these people are resistant to the virus, then you only have one more infected person. This reduction is significant and can severely limit the spread of the virus and make it much more manageable. And this is exactly what we're waiting for. We're currently self-isolating to reduce the number of people each infected person passes the virus onto, until we reach a point that there's enough immunity in the population that being back in public doesn't increase the average infection rate significantly. So, how do we reach this hallowed ground? How do we make being outside as safe as locking yourself away? Well, as we've already said, the key is immunity. Current modelling projects that when 60 to 80% of the population are resistant to the virus, we should be able to begin returning to normality. Once immunity reaches that level throughout the population, then the spread of the virus will be slow enough to be carefully tracked and managed. But 60 to 80% of the population is an incredibly high bar. For the UK, that would mean between 40 and 53 million people. At the time of writing, the UK has over 20,000 confirmed cases. So there's still a pretty long way to go. So how can a country possibly expect to reach these high levels of immunity to finally let us escape our homes? Well, there are 4 main paths that could take us back to normal: herd immunity, vaccines, waiting till summer, and hoping for a mutation. Herd immunity is something we've discussed before on this channel, and actually was the UK's tactic at the beginning of the outbreak. Essentially, herd immunity is achieved when enough of the population are immune to the virus, making it much harder for the virus to spread. The core of this herd immunity approach is simply letting people catch the virus. That's because as things stand, the only way to become resistant to the virus is to catch it and recover from it. So the basic idea behind this approach is to isolate the most vulnerable people while letting the virus spread around the rest of the healthy population naturally. As those healthy people recover and become immune, we get exactly the outcome we discussed earlier, where the virus isn't able to spread as fast, simply because most people are resistant and won't fall ill or spread the virus. The problem is that despite best efforts to protect vulnerable people, not everyone would recover. With the mortality rate currently floating somewhere around 1%, that's a lot of people who wouldn't survive the virus. Take the UK example again. If they need 60 to 80% of the country to get infected, some 40 and 53 million people, then with a 1% mortality rate, you're talking about somewhere between 400,000 and 530,000 deaths. So that method of reaching the immunity threshold might not be the best outcome. So, what about the other method of reaching immunity, through vaccinations? Well, this isn't a whole lot better. Certainly, far fewer people would die through this method, as the virus wouldn't be allowed to run rampant through society. Instead, people would remain isolated until the vaccine had been discovered, limiting its spread until enough people had been made resistant to COVID-19 through the vaccine. This might solve the death issue, but it certainly doesn't solve the speed one. Despite a good start being made on the vaccine, and despite Trump's confident declarations, we're likely not all that close to a vaccine being discovered, let alone getting that vaccine mass-produced and given to 60 to 80% of the total population. So we're talking months, almost certainly years, until people can properly end the isolation through this method. Another way we might be able to get out of isolation is if the virus becomes less dangerous during the summer. The conventional flu has one very useful trait. Its transmission reduces during the summer. So no matter which hemisphere you're on, at some point in the year, your country's flu rate will drop off for a season. We don't know for sure why the flu isn't able to spread as effectively during the summer months. But one theory is that the higher humidity boosts the size of the droplets carrying the virus, and as such, reduces the potency of the droplets, making them less effective. Regardless of the reasoning, flu simply isn't able to spread as rapidly during the summer months, and some are hoping that the same might be true for the coronavirus. Let's say super clearly here that the flu virus and COVID-19 aren't comparable. They're very different viruses, and to compare them would be foolish. But there are solid scientific reasons why some believe that COVID-19's impact would be reduced during the summer months. However, the World Health Organization has noted that in the southern hemisphere, where countries are currently experiencing their summer months, COVID-19 is still spreading rapidly, so it's not certain that summer will stop the coronavirus in its tracks. Comment below if you want us to make a full video explaining how COVID-19 will be affected by the summer. But the important thing for now is that if the virus is less effective in the summer, we might be able to relax the rules a bit and isolate a little less during the summer months. This won't mean that festivals will return, but maybe restaurants and bars might be able to reopen if they spread out their tables a bit more, meaning we might be able to regain some semblance of normality. Even if the seasons don't change how the virus works, the virus itself could change in the coming months. It's not uncommon for viruses to mutate, and as such, some are hoping that COVID-19 could mutate and become a less dangerous virus. Now, it's worth saying up front that this is a long shot. The virus could mutate and become less dangerous to humans, or scientists could find out that the virus was less deadly than we initially thought. Neither outcome is likely. While it's possible in theory, previous experience of outbreaks like this tell us that it's not all that likely, and certainly not something you want to be relying upon. So those are our 4 best options at escaping self-isolation. We achieve herd immunity by enough people catching the virus, either despite self-isolation guidelines or after them being loosened. We develop a vaccine which helps us achieve herd immunity without the death toll associated with the disease naturally spreading through the population. The virus becomes less deadly through the summer months, allowing normality to resume, even if it's only temporary, or the virus mutates and simply becomes less serious to humans. So, To answer the question, when will life return to normal, we have to know which path we end up taking. If we are waiting for a vaccine, we could be in some form of self-isolation for quite some time, as expecting the vaccine to be researched, tested, and mass-produced in the next year is very unlikely. Even giving it a year is optimistic, which means that lockdowns could be used, at least periodically, for the next 1 to 2 years, until a vaccine's ready. If we're hoping to achieve herd immunity naturally, that could happen much faster. It would be very deadly and would absolutely swamp healthcare providers. But if we just let the virus run rampant through the population, then herd immunity could be achieved pretty quickly. This is also a pretty stark warning. If you wanted to deliberately seek herd immunity, like the UK once did and Trump has alluded to, then its speed is an asset. However, it also means that accidental spreads could happen just as fast. Even if we're trying to self-isolate until a vaccine's ready, if people don't take it seriously enough, then a huge percentage of the population could be infected accidentally, leading significant death tolls and inadvertently to herd immunity. If instead you're hoping that the summer will kill off the virus, then you don't have too long to wait, at least in the northern hemisphere. It should become clearer, at least in the next few months, whether the summer could prove to be a respite from the virus. And finally, if you're hoping that the coronavirus will mutate into something less deadly, well, there isn't really a timeline for that. As I said, these mutations are rare and unpredictable, so I wouldn't hold your breath for that one. Either way, one thing is clear. We could easily end up being in self-isolation for some time, but the most important thing we can do is be diligent. The only way to stop the spread of the virus at this point is to limit the number of people you come into contact with, and that means isolation. Time will tell how long this outbreak will last, and how long we'll end up being in self-isolation for. But as boring and lonely as it might be, it's currently the best method we have to save lives. And we also made your colouring sheet, so how bored could you possibly be? Be sure to subscribe to the channel and hit the bell icon to be notified every time we release a video. And special thanks to our Patreon backers who make videos like this one possible.